Good afternoon and welcome to the Multicultural Media Online Conference. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator. These sessions are brought to you by the New South Wales Ministry of Health, Multicultural Health Communication Service, with the support of Multicultural New South Wales. Thank you very much for joining us today. This Multicultural Media Forum is a platform for multicultural media, health professionals, and also the community to learn about the latest health updates and prevention strategies and and resources for culturally and linguistically diverse communities. Before we start, we'd like to acknowledge the traditional owners of the land from which we all are meeting from today. We pay respects to elders past, present, and emerging, and acknowledge our Aboriginal colleagues and communities who may be joining us today. We also pay respects to multicultural communities and refugee communities who are represented in this session. I am pleased to introduce our guest for today. We are introducing a topic that some of you may have heard before, but it's something that's really important for us to all know. It's the Isolated Patients Travel and Accommodation Assistance Scheme, otherwise known as IPTAAS. It's a New South Wales government program that improves access to specialist health treatment, and the scheme provides travel and accommodation subsidies for people living in regional, rural, and remote New South Wales who need to travel long distances to access specialist health care. A very important service indeed. We have today, to help us explain and learn more about what IPTAAS is able to present to communities, we have Michele Maxwell, Director of the Strategy, Governance and Delivery of the Regional Health Division, and she's here at the studio with us. Hi, Michele. Thanks for joining us.
Thank you.
And we also have another Michele, and we have Michele Greenwood, Clinical Nurse Consultant of Cobbs Harbour Refugee Health Clinic, and joining us online. Hi. Michele, thank you so much for being here today.
Thanks, Jess. Lovely to be here.
And thank you. And we're going to have a very good discussion about this very special topic. It's New South Wales government is committed to improving healthcare outcomes and access to healthcare for regional New South Wales residents and to improving IPTAAS. Michele are here to provide information about how IPTAAS works, what you need to do to access this, and also what services are available. So we have a video before we start with the discussion and asking all these questions, and which will help you in the discussion. We have a video that helps promote IPTAAS. Let's watch this.
Ibrahim and Nori came to Australia with the boys in August 2019, so they've been here almost 5 years. They came to see us for their initial health assessment, and we found out that the two younger boys had nephrocalcinosis, and it affects their kidneys and it affects their eyesight. So they have to go for regular appointments down to Sydney.
Like every 3 months, I'm going to Sydney about the eyes problem, about the kidneys, for 6 weeks.
IPTAAS has helped a lot of our patients being able to travel down to John Hunter hospitals and Sydney hospitals for appointments and operations with specialists.
كده كنا جوان بمن كاريم هو جندي شنا سيدني بعد دكتورنا ما كاريم هو جن علاجي بكرن بس أو قال مستعدش ما رم قال قلت مرتاح مسا.
It wasn't for the program, we wouldn't be able to go to Sydney that many times and that much. It's a lot of help and gives us a lot of relief.
I don't think they could have afforded to manage to get down to Sydney without that monetary support, because it's so expensive to drive down with the fuel and so expensive to stay in accommodation. Now also that IPTAAS has increased the money that they get back, that's made it even easier for them.
بطريقة مترجم وبطريقة ميشيل إشمار فورمي داديرو احتياطي درابات غيري.
With the help of an interpreter and Michele's help, they usually fill out the forms for us.
We support all of our patients to get to those appointments. We make all the bookings for them, and if we can't get them into Ronald McDonald House, then we find a hotel close by that's reasonable price that we can book for them. If they don't get to those appointments, they could fall through the cracks and become more unwell, and then they could end up in hospital, and they'd be much sicker than they would have if they had got to go to those appointments. So it's actually really cost effective to make sure they do get to those appointments. And without IPTAAS, that might not be possible. So it really is actually saving the health system in the long run.
If he not help me, I can't go to the Sydney. I don't know for everything, but it's good. This Michele helped me in refugee clinic in Port Sarmore. IPTAAS, yeah, yes, very good.
Oh, that's a really good video. It explains what IPTAAS is. And we're going to go into the nitty-gritty about the service and how you can access it. And if you have any questions, please let us know. Now, Michele Maxwell, Isolated Patients Travel and Accommodation Assistance Scheme. First, tell us what exactly this is. I know we've heard a bit about it in the video, but tell us how this came about and why it's so important.
Thanks, Jess. Yes, IPTAAS is a New South Wales government scheme that is there to help people who need to travel long distances to access healthcare. And that's particularly for people living in rural, regional and remote parts of New South Wales, where those services are not available locally. So it's a subsidy scheme. It doesn't cover all the costs, but it does cover travel and accommodation if you need both of those things. And it really does help to ease that financial burden of needing to travel to access that healthcare. So it's, you know, a system that's been in place for quite a bit of time. And fortunately, we've been able to increase the subsidies in the last couple of years and also increase the eligibility so more and more people can access IPTAAS and get a bit more money back to help with the financial cost of having to access treatment.
And who can access IPTAAS?
Yeah, good question, Jess. So to be eligible for IPTAAS, someone just needs to be a resident of New South Wales, including Lord Howe Island, to be enrolled with Medicare. One of the things we do ask is that people are not already receiving financial assistance. So if you're receiving financial assistance from some other scheme, then or a third party insurance, then you're not eligible for IPTAAS, but otherwise you would be. We ask that people are referred to treatment at their nearest health service. We don't necessarily want people having to travel too far to access healthcare, or, you know, not everyone needs to come to Sydney. So if you're living in a remote part of far west New South Wales, you know, maybe Dubbo or Broken Hill is your closest health service. So we want to retain those services in those communities. So it is about accessing treatment at your nearest health service, wherever that is that's appropriate for your treatment. And the other eligibility is that you need to travel more than 100 kilometres one way, or in a week, if you've got to travel, you know, more than a couple of times, then the 200-kilometre cumulative distance is what we look at.
So if someone is eligible for IPTAAS, what payment can they get so they get transportation?
Yeah, so for travel, that can be private vehicle travel. So we pay a subsidy at 40 cents per kilometre for all the kilometres travelled to access that appointment. It can be public transport as well. So if you're needing to use trains or buses or ferries, taxis, including rideshare and Uber, air travel in special circumstances. So, and that does require a prior approval, but we will cover airfare where it's the most appropriate way for that person to actually travel down to their healthcare appointment. And then for accommodation, we cover all accommodation. So, you know, not-for-profit accommodation, places like Ronald McDonald House that Michele mentioned in the video. We cover, you know, hotels as well, Airbnb. So, and also staying with friends, we can provide a subsidy for that. All the rates are on the IPTAAS website, and we're always keeping an eye on those to make sure they are, you know, appropriate for what people are having to pay out. On the IPTAAS website is a list of the not-for-profit accommodation providers, and it's a good place to start looking at the more reasonably priced accommodation. And some of them then also bulk bill IPTAAS, so the patient only ends up being a small amount out of pocket, sometimes just $20 a night or so, which I know all adds up, but it just makes things a bit easier as well.
That really is important. And I think knowing if you had prior information about what's going to happen, if you do need to travel, if you have all this information, you're able to plan ahead. And I think what's important is knowing where to find all this information and how to access it. And Michele Greenwood, we saw you in the video, and it's fantastic that that family is able to travel and get all that support. Can you please give us some information on what your role is and the Refugee Health Service and the support that you're able to give these families.
Yeah, sure. So the Coffs Harbour Refugee Health Clinic, I established that as a nurse-led clinic in 2006. So only recently we have acquired, luckily, a social worker a couple of days a week. But before that, I was the social worker and the nurse as well. So I've used IPTAAS a lot over the years. They've been really supportive for our patients, because as it's difficult enough for our patients to get to these appointments, just navigating the transport as well and navigating the health system is difficult. Yeah, so I've got 3 other registered nurses, full-time equivalent, work with me, and I have a GP 2 days a week as well. So.
How important is IPTAAS? And Michele, we know you. You're such an amazing individual, and we know the important work that you do. And we've seen that in that video, and just how crucial this service is for families. And how is this helping the patients and communities in the long run?
Yeah, so we've had people from at least 8 different African countries. We have many people from Myanmar, from Syria, from Iraq, and Afghanistan. So we're a very multicultural community, and a lot of people from a refugee-like background live here. And a lot of them still struggle for many years to still navigate the health system because of how complex it is, and language is difficult to with health literacy and a whole range of things. So we've been helping, like I said, people for a really long time, and we've sent people down to many different hospitals, you know, from John Hunter to Royal North Shore, down to Sydney Children's Hospital, Westmead, to Royal North Shore Hospital, even out to Tamworth Hospital for some specialised treatment. So we've sent people to so many different places, you know, and Port Macquarie is our closest for all different reasons, for specialists, from neurologists to cardiologists to paediatric neurologists to paediatric ophthalmologists to people that are having cancer treatments that aren't available locally, to the burns unit down at Westmead. The list is kind of almost been endless. That we looked at it, how many people we sent down to so many different hospitals for so many different specialties and treatments that they just can't get locally, and you know, may never get locally. So, you know, it's a fabulous system that, like I said, if we didn't have that, people would have to turn around to us and say we can't go. We just can't afford it. And as I said in the video, people would fall through the cracks. They wouldn't get the healthcare they needed, and then they would end up in hospital much sicker. And yeah, so it's definitely is a very valuable system that we have, that we're lucky we have in New South Wales.
Thank you so much, Michele Greenwood. And I think there may have been some questions that people may have from the media online joining us today, or the health workers or the community. Please ask your questions on the chat, and we'll get Michele Greenwood and Michele Maxwell to answer your questions. But Michele, that video that you had, the family that you had, was Ibrahim and Nori Amured from Coffs Harbour. How was the process? So if you could just explain to us what happened when they came to you, and when you were able to guide them through this process.
So as the nurses, we see everyone for an initial health assessment, which means we do a range of observations and a suite of bloods that are all prescribed by the doctor. We take a great health history. Then we refer people, if they need to be, to whoever it starts, to talk to trauma counsellors, to dental, to optometrists, to you name it, we refer them. And in the Almured's case, obviously, as we got all the results back, then they see the GP. She discovered that they have some abnormalities with their blood tests, and then went on from there, from scans and then to the specialist appointments. So this has been going on now for a number of years with the family, and they have to regularly have scans and regularly go down, obviously, to be monitored by these specialists that we don't have in Coffs. And like they said, they couldn't have afforded to go down so many times. And we've had some great support from Westmead Hospital. You know, that always makes sure our families can get into Ronald McDonald House. They really give us a lot of support. And again, like I said, if it wasn't for IPTAAS, they couldn't have done that. And then we also have many other people who've been down and used this program a lot. And we have some people, you know, sadly with cancer, who are, you know, really unwell, and they couldn't sit in a train or a car for that long, because it's like 11 hours from here in the train, or a good 5 to 6 hours in the car to go to Sydney. So IPTAAS is great, because we've been able to get pre-approval for flights, because most people are still on Centrelink benefits because they haven't been here very long when we diagnose them with these problems. And so if we couldn't have the access to those services, there's no way people could, like I said, get there, because many people take years to get a driver's license and a car in the family, and it's just all those different layers that make it difficult for people to travel that far.
I mean, the more that you hear about the process, the more that you hear about the benefits of IPTAAS and the people that it has helped, and the money that goes back to the families. It really is important for us to share this information to others. Now, this video is available, will be available soon. And I think there'll be resources, and this video may be possibly in different languages, so that it'll be fantastic to share that to other communities. And Michele, with this IPTAAS program that you've been promoting, how are you promoting this there's a website, but other resources available that people can use to share with their communities?
There are just plenty of resources. So we've got banners, we've got lots of flyers and posters. They're all available on the IPTAAS website. There's a stakeholder toolkit there where people can download those resources. And we also have some translated information videos in quite a number of languages. So encourage people to go onto the IPTAAS website. We've got a whole range of videos, not only the story we've shared today, but, where general practitioners and other health workers have referred people to IPTAAS from the patient's perspective as well. So you can hear all sorts of people's views around how it's helped them. So encourage everyone to have a look at those. If you do want copies of printed resources, we can provide those to you as well. So please reach out and do that. I think the best thing about IPTAAS is to let everyone know about it that we can. We've done quite a bit of social media in the past, and that usually results in a lot more awareness, which is great. But it's really getting to the multicultural health staff, to people who work with people from culturally and linguistic diverse communities, so that as people are being referred to these health services, just as Michele does in Coffs Harbour, people can be saying, well, you might need to go and travel to see this specialist, but have you heard about IPTAAS? So really having that as part of the discussion with people right at the start, have you heard about IPTAAS? And, have a look on the website, see if that can help you.
Yeah, and Michele Greenwood, it really, we've seen in the video that there is access to healthcare interpreter services, so that information can be, shared in a way that's, accessible to communities as well.
That's right. So we use interpreters at every health encounter. Like, we couldn't do our job without them. They're amazing. And we often, an example is that I get people who, and they can't read or write sadly in their own language. So I can't have translated materials. So I make printed sheets to maybe give the taxi driver, maybe give at the airport. And plus, we've also gone to the airport to make sure people have got on flights as well, and to train stations to help book people tickets, because it's really difficult to navigate these systems when we've only been here a short time. Over time, people can manage, but those initial ones, I've had people that we've been down to Sydney on the plane, and then we've gone back and said, oh yeah, and this is using an interpreter, explaining everything lovely, having everything written out to, like I said, the taxi vouchers for the taxi driver, etc., etc. And I went back to his family and said, oh, the orthopedic specialist for pediatric specialist wants to see your son again. And he said, no, we're not going to go again. And I go, why? And he goes, it's fine leaving Coffs Harbour, but it's when we're coming home, no one helps us like you do in Sydney. So that was, that is one problem. It's all right at this end. So what we started to do was we contacted our colleagues at Refugee Health Service in Sydney, like Sandy Eager and Bronwyn, and they were able to find us some volunteers who were able to help people at the other end, as we call it, of the other end of the train or the plane or wherever, or, get even driving in and being able to park, but still once they get to that front entrance and at this big hospital, where do I go? So, yeah, we've been really, really fortunate to have some great support from our colleagues.
Look, Michele Greenwood and Michele Maxwell, I'm just getting goosebumps when you're telling me that story, because you're providing help from your end, and also trying to make sure that on the other side, people get that support, because language is really crucial. You don't understand, you're already upset, you're already sick, you're trying to get this treatment that could causing more stress. I can imagine. I mean, it's hard enough for English speakers to try to access information, what more those who have challenges in language. Michele Greenwood.
Yeah, absolutely. And, it's interesting, even my friends who are obviously grown up in Australia at school, they didn't even know about IPTAAS. I've educated a lot of people about the scheme, that they had absolutely no idea. And like I said, if you can't speak English, and like I said, most of these people have been here for such a short amount of time. They haven't even had the opportunity to learn any English because they've been too unwell, or their children have. So they've been supporting all of these appointments, and it's like so multi-layered and so many things happening. If we didn't have that good support, like I said, from IPTAAS, then from our colleagues in Sydney and the hospitals in Sydney who greet and meet people and make sure they navigate around the hospital, they would be terribly lost, like that gentleman with his son. And they said, well, we're not going to go again because, you help us, but no one does at the other end. Yeah. So it's part of it. I think that's my other message. It's part of it, that the people at the other end also need to help our patients as well when they're not English speaking.
Yeah, it takes a lot of people to try to make sure that things go well. Please ask your questions on the chat if you have any questions. My question is, what if I didn't know about this? A community member has gone and did all these, gone to all these treatments, but wasn't informed about IPTAAS. Could they access the service? Could they get reimbursed in the future?
Yeah, absolutely. So as long as, it's less than 12 months since, you had the treatment, definitely put in a claim for IPTAAS. We will pay that. And in other circumstances, the IPTAAS team would look at those circumstances as well. They're a really great group of people at the IPTAAS office. Michele might attest to this as well, who really want to help people. And so we've got, phone, people can call the Sydney office or the main line, but there are also physical offices in some locations like in Dubbo and Broken Hill and Tamworth and Port Macquarie. So they're places where people can go in and talk to the staff and get that, face-to-face assistance, but always ask the question. It's always worth giving someone a call. And if you have to, ringing the translation interpreting service as well to get that support. But they're there to help you to understand your circumstances and, make IPTAAS work for you. So it's very important.
What kind of allied health services are available? And I'll pass this on to Michele Greenwood.
I think that it would be open to, well, our patients go to Sydney, to be honest, mainly for medical specialists or for dental operations, like I said, cardiologists, pediatric nephrologists, ophthalmologists, a whole range of reasons. And often when they go down there, especially if they're children who have multiple problems, they're great. They'll get the whole team together to see them all in one go. So I'm assuming it covers for everything, because I have never been knocked back for any of these services that our patients are attending.
Yeah, and just generally, if they're not part of that whole multidisciplinary care that Michele's just described, then there are specialist allied health services that are eligible. High-risk foot services, some of the other clinics that require you to see someone with a bit more expertise in allied health. So they're on the website, but there's a whole range of specialised allied health services, particularly in local hospitals and community hospitals that are available as well, eligible for IPTAAS. Yeah.
And applying is easy. It's you just go online, is that correct?
Yeah, you can apply online. So and that's once you've registered online and got a bit of a profile in there, that's a really good way. If you have to make future claims, it remembers all your information. And it's the fastest way to get payment as well. For those people that can't work the online system, or they don't have internet connectivity or other things, then you can still do paper forms and fax them in, email them in if you've got a fax. Now, not if people have fax these days, but some do. Email them in, post them in even. So we, certainly cover a variety of ways that people can apply. There is a bit of information to be collected on the form. So things like who was the specialist you went to, name of your referring doctor, some of those things. So that's where Michele's team really sits down and works and supports the patients with applying for the forms. But we can do that over the phone to help you, or a lot of other health workers are doing that. Sometimes the accommodation providers where you go will also help you fill out the forms. So, don't hesitate to ask for help from either your social worker, your health worker, or where you're staying if you do need help with the forms.
So it looks like there's a lot of communication between the services. So you're going to the hospitals, of course, the services that provide the health care, and then you're going to the hotels as well, and the accommodation, and that's pretty good.
Yeah, well, there are quite a number of our regional accommodation providers who have, locations, and they're listed on the IPTAAS website. And they are really committed to helping people with IPTAAS as well. So there's a number of those locations throughout New South Wales where if you were going to, travel to Dubbo for specialised healthcare, there's Macquarie Homestay, for example, and the staff there, they do a lot of helping with IPTAAS forms. They, as I said earlier, they bulk bill. So they will put the claim in through IPTAAS and then only charge the patient a small, per night fee, rather than the patient have to put that money up front and then claim it back. So they're always a really good point of access. The people like Ronald McDonald House, to go to those places first if you do need to travel and stay somewhere.
That's incredible. I think that's really great information to know. And one question is about the health service and the doctors who are providing and referring this. How are we able to make sure that they're able to refer and also encourage other, their colleagues and other health providers to do the same thing?
Yeah, we're really trying to get that message out to doctors, particularly through practice nurses, but also the way that, doctors hear about new things, and to have that conversation so that if that doctor is referring someone to another, location that is a fair distance away for specialist healthcare, that they remember to say, and have you heard about IPTAAS? So, we're doing putting posters and flyers in GP practices in regional and rural New South Wales, and it's both the patient going to the doctor and saying, am I eligible for IPTAAS?
Yeah.
And if the doctor hasn't got time, maybe ask the receptionist or someone else. But it's just making that part of the conversation when you are having to travel for healthcare.
And so that's why it's so important for the media to know about this, for the health workers and the community leaders who are working with members of their community and sharing this information. One of the things I wanted to ask as well, Michele, in terms of this IPTAAS is it only in New South Wales, or is it available in other states as well?
So IPTAAS is for New South Wales residents, but all of the other states of Australia have their own schemes. They're called different things in different places, like Victoria has VTAAS, and they all are quite similar, but the New South Wales scheme actually has the broadest eligibility and also the most generous subsidies now since a couple of years ago. So, but there are these schemes in every state, and if someone in New South Wales had to travel interstate for healthcare, so we get a lot of people who travel from Broken Hill to Adelaide, that's covered because you're a New South Wales resident. So IPTAAS will pay for that. We also now cover non-commercial clinical trials. So if people are part of clinical trials and say you have to go to Melbourne or Brisbane to do that's covered by IPTAAS as well, because you're a New South Wales resident.
Well, Michele, with your work there as in Mid-North Coast and local health district, what are the testimonials that you've heard from these communities that must be in your mind and that's really heartfelt as well?
I guess one that really brings my mind is that we had a family, they arrived quite some time ago, like 2007, and they'd never been sick. And they were very well family. And then all of a sudden, sadly, the mum got a huge tumour in her throat and was had to be flown out from our hospital down to Royal North Shore Hospital for surgery. And fortunately, it was all successful, but she did have to go back for some further follow-ups and some radiation treatment. And so they'd never been sick. They'd never had to go anywhere. So the first thing the dad did was come to me and go, Michele, help. Where do I even start with this? I don't know what to do. I don't know how to get. One, it was they didn't know how to get there. He had to organise some accommodation to stay close by because he couldn't stay in the hospital. And so we started from scratch with IPTAAS for him and his wife to go. This was on the return journey to go back down, because I think they ended up going down about 3 times for treatments and follow-up. So, yeah, he was really, really thrilled to know that he was going to get some financial support because, as you can imagine, he couldn't work because, there was a whole range of other things that came into play then, because he had to drive her down and they had to stay. He had to stay separately to her, and just all those expenses. And, yeah, he was so grateful that this scheme was around and he could tap into it and it wasn't so much of a financial burden.
Yeah, I think it's an incredible program. I think to the details of how people can access it, and that's really such a heartwarming story where, you know, sometimes you don't get sick and you don't know, and navigating the health system is very challenging, but if people are around you who are able to help, there are people around you. So I think that's really crucial for people to know. Now, the number is, I guess it's here, 1-800-478-227 or 1-800-IPTAAS, and that is that link and telephone number is available on the chat and also on the website. And also, you can call NATI accredited or in the National Translating Interpreting Service at 131-450 if you need healthcare support. We have run out of time, but I think this is such an important program that people should be sharing to communities. Michele, Maxwell, any last words you'd like to share to the communities and to the audience listening to us today?
Just mainly, just if people can think about IPTAAS when they're talking to their patients, and certainly if they know that they need to travel to access healthcare from a regional, rural or remote area of New South Wales, think about IPTAAS and think about IPTAAS, how IPTAAS can be part of that healthcare, because as Michele said earlier, it is that end-to-end journey of leaving home and all the complexity of navigating the system. And if IPTAAS can help a little bit to alleviate some of that financial burden and know that you're supported in that, then I think that's a great thing for people to remember.
Thank you, Michele. And Michele Greenwood, any last words you'd like to share with the community? And first of all, I'd like to thank you for all the hard work that you're doing down there with the communities.
Thanks, Jess. I just reiterate again, the same as Michele said, that it's really important that the message gets out there for not just the non-English speaking community, but for all communities to understand that there's great services available, and it could be the difference between people going or not going to their appointments.
And thank you so much, Michele Greenwood, Michele Maxwell, for being with us today and sharing all this information about the Isolated Patients Travel and Accommodation Assistance Scheme, or IPTAAS. Find out more in the website. And if you need other support, please call other services and the number available. But please find out more about it, share it with your communities. And it's fantastic that New South Wales Health has a long list for eligibility for people to access it. So thank you again. We'll come back in another fortnight for Multicultural Health Week on September 4th. We'll hope to see you then. Take care. Bye.